Hello, everyone, and welcome to day 3 of the holiday giveaway challenge week. In tonight's live, we're going to be practicing breathwork together. So just like yesterday, I hope you dressed as comfortable as possible and you are seated somewhere either on the ground or on the couch where I am or in a chair if you're at your computer right now. Breathwork, of course, can be done anytime, anywhere. But for the purposes of today, I'd rather you be stationary so that we can experience a few things together, okay? So in tonight's live, I am not going to spend time educating you about breathwork and why we do it for the nervous system. If you're interested in getting a better idea of the science of breathwork and why and how I prescribe breathwork for my patients, I'm going to leave a live replay link for you in the chat for you to check out, okay? In this specific video, I will teach you all about the impacts of breathwork on the nervous system and our anxiety and depression symptoms, and common mistakes that people make when it comes to using this tool. So if you haven't watched it yet, highly recommend that you do that. If you're not able to click on this link because you're watching this live on your phone right now, then feel free to message me after on Instagram at Dr. Jenna T or on Facebook. Just tell me you're looking for the breathwork replay and I will get it to you. And for those of you that are in here right now, I'm going to paste it in the chat if you want to grab it. Okay? So before we get started, I want to ask you a few poll questions, just like I've been doing on the other nights of this holiday giveaway challenge, because I want to see how familiar you are with breathwork and how it's currently playing a role in your mental health plan. I know I have some of my patients here on this live who are practicing breathwork all the time. And then on the other hand, I have beginners who have no idea what type of breathwork to practice. So I want to know where you're at. I'm going to open these polls right now, and then we'll be one step closer to starting our live breathwork session. So let me grab those for you now. Let me know that you can see them on the screen and go ahead and give those an answer. Okay, I'm going to read some of these answers real quick, just so that we are all on the same page. I'm really happy to see that a lot of you have breathwork already a part of your daily nervous system routine. Amazing. For those of you that answered the how often that you practice breathwork, it seems to be split between multiple times per day. So I guess a lot of my patients are in here or other people who have interfaced with me before. And you're like, okay, I'm on top of this. I'm doing my breathwork a lot and consistently. And then the other half of you are not as much as I should. So hopefully tonight is going to provide a little bit more motivation to get you to do that. Because I think that just like meditation, we put this roadblock in the way of like, it's hard. I don't know what to do. I don't know how to do it. And it's because we're not actually just jumping in and doing it. And then when we realize how easy it is, we're like, okay, I really shouldn't have been negotiating with myself. So hopefully tonight is going to change that. I then asked you guys, when do you practice breath work? And I'm seeing that most of you are saying that you're practicing when symptoms come up. So you are clearly a part of the population of people that I say are making mistakes when it comes to how we practice breath work. Okay, so if you have not seen my other live that I did on breathwork, that is what I want you to watch. After we do this together, I want you to go into, my YouTube, grab that link in the chat here or send me a message and ask for the breathwork replay so that you can understand what the difference is between practicing breathwork consistently on a schedule and then what it looks like when we're only practicing when symptoms come up. Okay. And the next question I asked was, how long do you practice for? And most of you are in that 1 to 3 minute mark, which is great because that's where I want to see you. A bunch of you say I take a few breaths and that's just however long it takes. And then there's a very small amount of you that are doing over 4 minutes. I'm going to close the poll right now. Most of you are in that sweet spot and we are going to do 3 different types of breath work where we are going to do it for about 1 minute to 2 minutes to 3 minutes. So we're going to get inside that bracket. So that you can have the experience of what it is that we're looking for. Okay. So The way that I'm going to run the breathwork sessions, like I just said, is we're going to try 3. We're going to do 3 together tonight of my favorite techniques that I personally practice on a daily basis. The first one is going to be the asymmetrical breathing technique, which I teach in Peace of Mind Method as a staple breathwork practice. We are then going to learn forced exhale breathing, which is one of my personal favorites for when my anxiety symptoms are present and I need to really get into my body and recalibrate. And then we're going to practice alternate nostril breathing, which I also teach in Peace of Mind Method. And it's one of the routine breathing techniques that I like to commit to when I'm practicing in random moments of the day. And if you're a beginner, it's going to be scheduled. Okay. And I can't emphasize that enough. So those are the 3 techniques and exercises that I lean toward most often. And it doesn't mean that they're the best. I just want us to have a different experience to walk away with tonight. So we're going to try each different one at a time. Then we're going to have a little chat about it. And then we're going to move on to the next one. Okay. So before we start, I need you to understand that breathwork is not something that we are doing solely to get rid of symptoms. And like I said already tonight, this is a huge mistake that I see people make. They only breathe when anxiety is present. And this leads to confused neural pathways that are connecting breathing with anxiety. And it also negates the fact that we have to be regulating our nervous system throughout the day, not only when we're noticeably uncomfortable. The whole foundation of what I teach is that the nervous system is responding to cues and signals between the body and the brain on a second-to-second basis. And for us to change the incorrect communication and rewire the neural pathways, we have to catch our nervous system in moments of non-obvious stress too. This allows us to fudge the state of the nervous system and provide it with more flexibility throughout the day. It's kind of like manipulating yourself, but in a good way, okay? So today, everything that we practice can be done multiple times per day or on an as-needed basis, but make sure to create a schedule if you're new to this so that you don't forget to do it. Breathwork is so easy. It takes no time at all. So it's not fair to take this extremely simple tool away from yourself. Today, I did it while I drank my coffee, then again while I was driving, then again when I was in the forest, and now I'm here again with you. So we all have time. Can we agree on that? Give me a thumbs up in the chat if you can agree that we all have time to do like 1 to 3 minutes of something at a time. Yeah, that's what I thought. So let's start with the first activity. We're going to do asymmetrical breathing, which means that our exhale is going to be longer than our inhale. And that's really all it is. I'm going to count you through this so that you do not have to think. And if at any point you feel like you can't keep up with the counts, just follow your own rhythm. This one is really hard to screw up. I'm going to show it to you once, and then you guys are going to follow, okay? Just so that you have an idea of what you're doing. So we are going to take an inhale through the nose. I don't care if it's through the exhale is going to come through the nose or the mouth. Makes no difference. But we're going to breathe in for a count of, I'm going to count to 4. If you can't breathe in for that long, please do not hold your breath. It is going to make you anxious. Let it just move. But we're going to breathe in for a count of 4, and we're going to exhale through the nose or the mouth for a count of 7. You can close your eyes. You can keep your eyes open. I'm going to close my eyes just because it's weird to stare at myself on the screen. But you do you, okay? There is no position that we need our body to be in. You can place your hands on your knees. You can put them in your lap. You can put them behind your head for all I care. I don't give a shit what you do. We're just going to be focusing on our breath, okay? So whenever you're ready, we're going to take a slow, deep breath in for a count of 4, 3, 2, 1, and a slow exhale for 7, 6, 5, 4, 3, 2, 1. Again, take a deep breath in. Exhale. Again, deep breath in. Exhale. Again, deep breath in. Exhale. Again, deep breath in. Exhale. Keep that going. A deep breath in. Relax the face a little bit more. Exhale. Last time, deep breath in. Exhale. Open the eyes. Hopefully you guys heard my snapping in the background, which was keeping our rhythm. And I want to know from you right now in the chat, what did you notice in your body when you were doing that breathing activity? I'll wait for you to type it out. Kind of surprised that my dog is sitting on the couch just staring at me. He didn't even want to come over and cuddle as I was doing my breath work. Okay, so we felt gooey. Our head felt heavy. Is there anything that we noticed before the contrast to when we started to when we did it? Because I think that was only like 6 breaths. Okay. They felt calming, relaxed, shoulders felt loose. Okay, great. You started to yawn. If you start to yawn when you're doing your breath work, that is like the world's biggest signal telling you that you do not have enough oxygen in your body, and your body's like, give me more. Okay. So you use yawning as it's like a great green flag to let you know that you have to be doing this more often. Okay. Rhiannon is saying that the asymmetrical breathing is her favorite. The exhale gets out the anger and the bad energy. The next one that we're going to do is for that. Come on. If you feel more relaxed, this is super common. Okay. When we breathe in, we're going to notice that our sympathetic nervous system gets activated, which I can now tell you guys because you were at the Science of the Nervous System live on Monday. And when we exhale, the parasympathetic nervous system is activated. So breath work is actually not just a relaxing response. It's supposed to help with the variability and the adaptability of our nervous system because it's using both sides of it. So when you're breathing in, it should feel more energizing, and the exhale is what should let your body feel like letting go. Okay. Alicia, you're saying that you feel dizzy when you do breath work, and that is totally normal. Okay. When you start getting oxygen to your brain that it's not used to, you can almost feel high. You get like tingly, you can get like a little dizzy, a little offset. And I get that very, very often when I'm doing breath work. And that's why I like to press and pressure my exhales, which is what you guys saw me doing if you had your eyes open and you were watching. But I was going on the way out. And if I do it with my mouth closed, I usually create it's called yogic breath, and we learned that in Peace of Mind method, but that is the sound that I use on the way out. I never just allow my breath to be thin. I always want to keep it thick so that there's a pressure. It allows me to not get that dizzy feeling. So that is common, okay? It's not something I want you to freak out about. It is totally normal when we are breathing because we are getting oxygen to our brain that it is not used to. And then Sam just said, yes, this is my go-to routine. It brings me back to baseline. What did you guys like about it or dislike about it? Because everyone has their own thing, their own type of breath work that they like, or there's a sensation they don't like. Like example, Alicia, if you don't like that type of breath work because it makes you dizzy, you'll stay away from it. That's how I feel about box breathing, which is a really popular breath work. And I teach it in Peace of Mind method, but I hate it because I don't like the sensation that it creates in my body. The counting is irritating for me, and it also gets in the way of like my perfectionism of, did I create a perfect box? Was it actually 4, 4, 4, 4 of timing? And I can't get into it. So what did you guys like about that or dislike about it? Yeah, Kelly, the feeling like you can't get a full breath in is also really common. And we're going to do some fun exercises at the end for what I do when that happens to me, because I am a very air hungry person. And I talk about that in the previous breathwork live that I've done. So if you want to hear all about my air hunger, then you will go watch that. But we will do some exercises today specifically for that, because I know it's really common when we have anxiety, where we just feel like we're not getting that like sufficient amount of air in. And that is where I love to use pressure systems. Okay. So let's move on to the next one, which is forced exhale breathing. This is the one that I use when I'm really feeling my symptoms. And I do it on the spot. And I will often use this one when I need to be like emotionally regulated and bring myself back to like my equilibrium. For some of you, you already mentioned that the asymmetrical breathing was the thing that you love to use. For me, this is just it for me. And it's probably because I have a lot of pent up emotions inside of my body. And this helps me, as Rhiannon said at the earlier part of this conversation, it gets the anger out. Okay. So this is what the forced exhale breathing looks like. We take a deep breath in. It doesn't have to be all the way. It's just a, and then on the exhale, we go, shh. Like you are telling the most annoying person in the world to be quiet for as long as humanly possible. Okay. So we're going to do that a few times. I'm going to do it until I feel my body change. So I'm going to keep you guys along for my ride. If you like to focus on just the sound, go for it. If you want to add a little bit of movement to this breath work, something I like to do is breathing in and I pull the air, and then on the exhale, shh, I push away. And it will look a little bit like Tai Chi. You know, when you're walking through the park and the people are doing the thing, it's just an energetic movement of how I like to sometimes imagine my breath is just getting shoved out of my system and my emotions are being pushed out of my system and everything is coming back to neutral for me. Okay. So if you're closing your eyes, go for it. If you're keeping them open, go for it. You're going to have to stare at my scary face as we do this. We're going to take a deep breath in, filling the lungs. And on the exhale, pushing it out, making that shh sound. Shh. Working that pressure against the teeth. Again, deep breath in. Exhale. Shh. And again, deep breath in. Let it out. Shh. Again. Try and lengthen that exhale even more on the way out. Shh. Even slower this time. Deep breath in. Exhale, pressing it out nice and slow. Shh. Last time. A lot of pressure through the teeth on this last one. Shh. Opening those eyes if you have them closed. Yes, my dog walked away too, Nick. He was like, I ain't having any of this shit. I don't even know what you're doing. So let me know in the chat right now again, what did you notice in your body when you did this breathing activity? And you can compare and contrast to the last one. Just let me know what you're feeling at your baseline. Where are you at now versus before you did that one? Okay, cool. So some of us are not noticing that much of a difference. We're just still feeling chill. Okay. If you don't notice a difference between those two, what I would suggest is when you're feeling anxious, if at any moment it happens tonight, it happens tomorrow, you get activated, someone bothers you, you feel irritation, whatever comes up, try the two different types of breath work and see which one feels like it's bringing you to a better place. Okay. So a more neutral place. And this is why sometimes the breathing technique doesn't matter. It's more about the timing of when we do it and how we do it. But people tend to notice that the first one is more relaxing and the other one is more releasing. And there is a difference between those two things. Okay. I can't believe all you guys have dogs here that are freaking out. Dogs around the world. I'm really sorry for doing this to you. Okay, so Alicia, the reason why you're not feeling as dizzy in the second one is because of the pressure system on the lungs. So if that is you, you're probably having air hunger, which is what I have, and you just like to have more resistance, more thickness to the breath so that you don't feel the emptiness of the lungs. Okay? My dog is so used to me doing this that he's just like, I'm out. He just like walked away and went slept somewhere else. Okay, are we ready to move on to the next one? Give me a thumbs up if we're ready to go. This one's going to take a little bit more coaching, more coaching and training, because it is a little bit funky with the hands. Okay. This is a traditional type of yoga breath work, but we are not going to do it exactly in the traditional way. We're not going to use our thumbs and our pinkies because I think that that's too confusing and it's not necessary. We are going to all take our point your finger up, and it might look like you're picking your nose from afar, but you're not. You're just doing breath work. And now I just realized that when I'm driving and I do this, it probably looks super weird from the window, but that's fine. If someone is staring at me as I'm driving and they see me doing this and they think I'm picking my nose, that is on them, not on me, because I feel great as I do this. So we are all going to start by placing our finger on one of our nostrils, and you're going to close it. Okay. And I'm going to talk to you now while I have one nose plugged. I want you to imagine that you have floss, or you are air flossing your nose. So the motion is going to look like this. The air is going to come in through one nose. We are going to switch. It's going to come out the other side. Then again, the air is going to come in through that nostril. You're going to switch. The air is going to come out. So you're just having this motion of, think of it like a hill. You're going to go up through one. It's going to connect through the top of the nose, come out through the other nostril. And then it's going to come back in through that same nostril, lift through the top, and then come out through the other. The visual is super important because I think that the body coordination of all of this is a little confusing for people. So you're going to place your right finger on your right nostril, and we are going to breathe in through that left nostril, switch, and then breathe out through the right nostril. And again, one more practice. Breathe in through that right nostril, switch, and then breathe out through the left. Okay, that was just your practice. We're going to do a few of those in a row. It's going to take quite a bit of time to get done because it takes a lot of time for the air to move through. But what I want you to know is that I really like to use this breathing technique, especially when I need to refocus myself. For those of you that get like ruminating thoughts, for those of you who have a difficult time staying in the zone, like you're doing your breath work and then you're like, okay, like I can also like kind of do all these other things as I'm doing the breath work. If you need something to keep you interactive, this is your go-to. That's why I love to use it. I also love to use it because of the pressure systems that I've been talking about today. It makes the breath slower, both the inhales and the exhales, because it can only travel through one nostril. That leaves me with a lot less air hunger. It makes me feel like my lungs are getting filled a lot easier. So this is, I would say, a lot of people that I work with love this one just because of how it's just, you're in it. Like you can't not be in it, because like if you try to do choreography with your fingers on your nose, like you can't be anywhere else. The second you start to think about something else, you're going to screw it up. So it does keep you very in the moment, self-aware, totally in flow state. Okay, so let's start. You can close your eyes if you feel comfortable doing that, or you can watch so that you can follow my hands on the screen. So placing the right finger onto that right nostril, letting go all of the air from the lungs, and breathing in through the left nostril. Hold at the top, switching the finger to close the left nostril, and then breathe out through the right. Hold everything at the bottom. Keep the fingers. Deep breath in through the right nostril. Hold at the top and switch the finger to the other nostril. Exhale through the left. And deep breath in through the left. Switch the finger to the other nostril. Exhale through the right. And breathe in through the right. Switch. Exhale through the left. In through the left. Switch. Exhale through the right. In through the right. Switch. Exhale through the left. And last time, in through the left. Switch. Exhale through the right. And releasing the hand down and opening the eyes if they were closed. So quickly type, let me know how that went for you. What did you notice in your body, in your mind as you did that one? What did you like about it? What did you not like about it? Give me your feedback right now in the chat. That's kind of cool, James, that you felt something in the center of your eyebrows there. Like the air was actually getting up into your nose and you could feel it and follow it. Yeah, Amy, this one is definitely tricky with a stuffed up nose. Breath work in general is going to be pretty challenging if our nose is stuffy. And that is, just as an aside, I can give you a little fun fact while we're here. That's why a lot of us get more anxiety when we're sick. We get that sensation of like the heart fluttering and the dizziness and the discomfort and that feeling of doom or like restlessness in the body, because we're not getting enough oxygen and we have to make sure that our air is coming in. So make sure in the future that you blow your nose before you do breath work. Otherwise, you're going to have boogies flying everywhere, especially when you do that one. If you do breath work enough, you won't have to blow your nose anymore. There's just going to be boogies on the floor 24/7. Okay, let me see the feedback that we have going on here. Yeah, if you like that one, stick with that one. That is like a classic scheduled breath work for me. Like every morning, let's do it, right? It's a routine. It's something that you can stick to, and it's so easy. Look how easy that was. We just did it. It's done. Yeah, Rhiannon, you forgot about this one. It calms you down a lot. Yeah. And it does help with ruminating thoughts. That one, I love doing that one when I'm thinking too much and I'm like, wow, I really need to get out of my head and into my body. And I haven't done my breath work yet. Oh, a mouth breather. Lauren's a mouth breather. I think a lot of us are mouth breathers and we don't really notice it. But mouth breathing can cause a lot of anxiety in the body. And one challenge that I gave my Peace of Mind Method members, I think 2 months ago at this point, and if you're in here right now, you're going to remember me saying this in the group call and none of you did it. But I challenged everyone to spend an hour a day with tape on their mouth. If they were just doing their work at their computer, or if they wanted to try sleeping with tape on their mouth, or if they wanted to go on a walk and tape their mouth, just so that you can see how often we're breathing through our mouths and not getting a deep breath into our lungs, because the nervous system is feeling that. And it's saying to the rest of the body, oh, we're not safe right now. We're not doing too well. We need to now have symptoms that are in alignment with anxiety, because right now the brain is thinking that there's not enough oxygen. So that is a fun test to try with yourself. If you have the commitment and you're doing nothing at your desk, maybe leave like a roll of tape. If you have one of those scotch tape things that you can just rip off and give it a shot, just to see what it feels like, and see how much you're impacted by mouth breathing. Okay. So the next thing that I wanted to do here was a physical pressure exercise on the body. I'm going to back up on my couch so that you guys can see what's going on over here. But we're going to just do a little, let's call it a freelance breath work, where I don't care if it's in through your nose, out through your mouth, you want to do all through the nose. I don't care. I just want you to focus on the hands and where they're placed. Okay, so we're going to start with the eyes closed. If you are not able to understand where I'm telling you to place your hands, then you can watch me. You know what? Just open your eyes and watch me. It's easier that way so that I don't have to talk so much and I can breathe too. So we're going to start by placing our hands, like our thumb and our finger, right underneath our collarbone. Okay, so we have our collarbones here. We're going to drop a little bit lower so that we're on either side of the rib cage. And I want you to pinch inward. So not pinching the skin this way, but just press your fingers in towards your sternum on either side. And I want you to take a deep breath into those fingers and feel like your chest cavity is lifting forward into the two fingers. And then release it out. Again, take a deep breath into those fingers and press the fingers back into the chest. And release it out. Again, deep breath into those fingers. Press the fingers back into the chest. From here, I want you to take both hands and place them on your chest. Think like a butterfly position, as if you're going to do like a somatic butterfly hug, but opposite. So both hands right underneath the collarbone, pressing in. Push in nice and hard onto your chest. And breathe into the hands. And at the same time, keep those hands and the pressure back into the chest. Deep breath. And let it out. And again, deep breath into the hands. And let it out. Last time into the hands. And let it out. And our last hand placement, we're going to take those hands around the rib cage. Thumbs to the back, fingers on the front. This time when you inhale, I want you to expand your lungs forward into the fingers, sideways into the web, and then back into those thumbs. Closing the eyes, deep breath in, filling the entire lung cavity. And on the exhale, pressing those ribs back in and down with the hands. Keep that pressure in the hands, breathe into them. Exhale, release. And last time, deep breath in. And exhale, release. And placing the hands back down, opening the eyes if they were closed. So for those of you who are ever feeling really anxious, or you're feeling really activated and you are not responding well to your breath work, or if you are doing your breath work and you're like, oh my God, this is making me more anxious. I can't catch a breath. I can't feel full enough. This doesn't feel like it's giving me what I need. This is the technique. You're placing pressure on different areas of your rib cage so that you are signaling to your nervous system that you are being held. And it really is that simple. You don't need to be hugged to make this work. Our body is going to release oxytocin when we do this because we are receiving the sensation of there being pressure on our rib cage. And that also relates back to what I said earlier with that pressure system. You know, we did it through the teeth earlier, or we were adding, a single lift through the nose. It's like we are closing the amount of space that the air can go. So it's making us feel like it's fuller. This is doing that in a physical way. when we are putting pressure down onto our lungs. Our lungs work in a negative pressure system, which I talk about in that previous breathwork live replay. Again, if you want to catch it, you're going to learn more science like this. But our lungs love that negative pressure. So the more weight that there is, the more full that it makes the lungs think that they're getting. Okay, so this is a nice little science hack that you can use on your own body. For those of you that maybe didn't feel amazing when you did the first 3, but then you did this one and you were like, oh, that felt really nice. Stick with this one first, right? We don't have to fit ourselves into a certain area and be like, well, that one's supposed to be good for anxiety, so I got to stick with doing that. I actually had a patient that was not doing well, with an anxiety attack. It was happening a few weeks ago, and he was like, I'm going to go grab a straw and and do it through that so that I can close the amount of space in the air, because I saw it online that that's what people are doing. And I was like, don't, just breathe, use your body, instead of making it about this attachment to something else. Like we can build that within ourselves, using our own tools. Okay. Lauren, I realize how much I don't breathe well with this class. It's true. If you don't know how to breathe and it's not a part of your daily nervous system regulation techniques that you're using, why would you be good at breathing? Why would it be something that you're doing on a frequent basis, right? We think in our heads, okay, well, my lungs are going to keep breathing and my brain's going to keep signaling for my body to keep breathing, so I don't really need to breathe. And I do talk about this in the other live, so I do want you to watch it. But like, if that is the signal, is short and shallow breath that your body is getting all day throughout the day, your body isn't going to feel non-anxiety. It's not going to feel unanxious. It's going to feel like it's always under threat and that there's always something, to be looking out for, because you're sitting there going, it's like, that's not real fulsome breath. And that's why I tell people to do it consistently on a schedule, so that we are consistently showing the nervous system, let's do it this way. Let's feel this. Let's experience this. It doesn't have to even be related to anxiety. It's about the continuous communication that is happening between body, brain, through the nervous system. Okay. So Amy, you want to know, do you do all 3 positions or focus on one? That's up to you. Sometimes I do breath work totally like this because I don't feel like moving my arms too much. Sometimes I do this one if I'm feeling like my heart is racing and I just want to calm it down. And if I'm feeling really air hungry, then sometimes I'll go to do the wrap around my rib cage. So you can play around with any of those. None of them are right or wrong. None of the exercises I taught you earlier are right or wrong or the best. There's just a few to try so that you can feel a little different. And that was the point of me going live with you guys tonight, to share that with you. If you have any questions for me right now, please feel free to put them in the chat. James is asking right now, how often per day do you recommend it? I did it 4 times today, and I'm going to be doing it again tonight when I teach. So that's 5 times a day. Like, why would we not schedule a minute or 2 a few times a day? It seems foolish not to do that for ourselves. And you guys can habit stack, right? When you're drinking your coffee in the morning, maybe you want to do it then. Maybe when you brush your teeth, you want to do it like right after you put your toothbrush down. If you're someone who pets your dog, maybe you commit to 1 minute of cuddling and snuggling with your dog and practicing your breath work as you're doing it. Like, you can habit stack this stuff. Like I said, I do it in the car, right? Get it done. Even if you are driving and your hands are on the wheel and you're like, wow, this person in front of me is going so slow, you can be like, shh, just get it out. Like, move that stuff through you. There's so many opportunities throughout the day to be regulating our nervous system, and we're missing all these small little moments of doing that. And that's why I talked about this, I think on Monday night, that we are spilling over because we are not doing our due diligence to show up for ourselves at these different juncture points throughout the day. And then we're at the end of the day being like, why am I so anxious? It's like, you haven't done the regular human being things that you are intended to do to not feel this way. So how can we have the expectation that things just go great without doing anything? Okay. So I'm not seeing too many questions come through in our chat unless you guys are busy typing away. Maybe I missed them in the Q&A. Let me go give that a look. Please hold. No, we're good. You guys don't have many questions. I guess that means that I was so unbelievably clear this evening. Yes, Jenna. Okay, so Now that you know these few breathing exercises, I suggest that you try them on for size. Okay, guys? Build yourself a schedule to follow for the next week. So use the tips that I talked about tonight, build yourself a schedule, get it done, commit. Breathwork is going to have the biggest impact on the nervous system when it's done consistently. And again, if you want to learn more about the science of the nervous system and breathwork, and you want to learn all about the why, then what I'm going to get you to do is watch that live replay that I did a few months ago. I will post it again in the chat so that you guys get access to it. Hold on 1 second. And again, if you can't get that link, shoot me a message, Facebook or Instagram, so that I can get you that. I want you to give yourself a big thank you for showing up tonight and doing the work so that you can learn these techniques. You guys have been really diligent this week and proving that you have what it takes to start regulating your nervous system properly. So I want to wish everyone good luck here who's now been entered to win Inhale, Exhale, the Breathwork mini course. And I cannot wait to see you tomorrow at our live yoga session. So if you're interested in diving deeper into this practice, I'm going to get you to check out the details of the Breathwork mini course as well. And I'm going to post that in the chat so that if you do know that you want to do it and you want to learn more, that you can go do that now. Okay. I'm so pumped for tomorrow. I can see you guys coming and being like, yes, yoga. I will be posting those links in the Facebook group. I will also be sending out an email for everyone to join with that link for yoga tomorrow. It is going to be lots of fun and lots of torture. All right. Have a great night, everyone, and I will see you soon.